when I relocated to Northwest Arkansas, I was like, hey, you know what would be awesome if I could like start some kind of femtech hub. Because, at that time, like I said, I was the only one, and I was looking for other founders who may have been going through what I was going through, or if I can extend the help to alleviate the things that I have been going through as a female founder who was focused on women's health. And so when I met Elizabeth, it was just like, we gonna do this. And then you would have thought we've known each other forever. Ended up having a meeting. She was like, I know someone else who also is building a femtech company who also wants to help when it comes to women's health. And then we're also business owners ourselves, moms. So it's like a lot to juggle. But again, using our own experiences to help others who are also looking to help or find solutions in women's health, because we're so behind as a society when it comes to women's health. We feel like there are so many problems that could be solved by people who are just interested in doing the work.
We kept having the same conversations on challenges that we were facing that we felt were really unique to us as women versus our male colleagues. And just revisiting that conversation over and over again, it was like, we've got to do something about it. So what does that look like? And it was really when we were introduced to Natalie, our fellow co-founder, whose background involves a lot of that strategic partnerships and matching opportunities with resources, that it took off.
This is a regional initiative in that we're here in Northwest Arkansas. We're hoping to serve the broader community of the Heartland, the flyover states, the areas that get less attention from your venture capitalists, but these are also high areas of need in terms of women's health.
There's so many problems when it comes to women's health. We know 1 in 4 girls miss school because they don't have access to period care. 1 in 9 college students miss class because they don't have adequate period care. But yet, when it comes to these colleges and you look at the enrollment, it's mostly women. And it's like, so we're paying all of this tuition, but our school can't look out for us to make sure that that's something we don't have to worry about. Or menopause, or when it comes to the mortality rate of maternal health, in this state.
We were really lucky to be partnered with Stitch Crew out of Oklahoma City, and Erica Lucas. They already had the infrastructure in place to execute an accelerator program and a really good experience for women.
We're targeting 5 different companies to really curate and experience training, workshops, capital connections, and curate the programming around what those individual founders really need to move their business or their idea forward. So this is going to be a pilot cohort. We're very excited to get them off the ground and give each of them $10,000 in non-dilutive funding to spend that money for their business in whatever way they deem most important. So we're not going to put, big restrictions around how they spend that money. We trust them to spend it on their business and their idea to get it off the ground.